My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you so much. Welcome to today's clinic. Today it's our 40th Fridays clinic. So in the next few minutes, we are going to talk about a special topic. This topic is very important to virtually all women. There are clinics on Fridays that are devoted to women about the 40s. The reason why this particular clinic is very important, especially to women above 35, is because as you get older, eventually when you become pregnant, there are a couple of things you need to be conversant with. There are a couple of expected complications. So today we're going to look at the different types of delivery. So we're going to look at vaginal delivery and cesarean section. Very important topic. Now, if you are currently pregnant, I hope they've told you your best method of delivery. The ultimate aim of the two methods of delivery is to have a healthy baby and a healthy mother. So it doesn't matter if you're going to be delivered through the vagina. It doesn't matter if you're going to be delivered through CS. So please, please, please be careful. There is absolutely nothing wrong in having your baby through CS. And having your baby through the vagina doesn't make you superior to women that had their baby through the CS. Now, a couple of women have experienced both vaginal delivery and cesarean delivery. They all have their pros and they all have their cons. Okay, so please, when you come in, before I go into details, please let's know who you are. So what's your name? Where are you located? Please make sure you follow our group. Make sure you follow our page and also follow our YouTube. We recently started daily YouTube updates. So if you're in YouTube, please check our handle, Dr. Trudy Ufondu at Snowspirations Global Health Solutions. We have so many important videos which can help you to know better. But my clinic today is specially devoted to women that will become pregnant, women that will have their babies, right? Now, the first thing you have to be conversant with, it's the progress of your pregnancy. When you get older, there are a couple of expectations. There are a couple of likely complications you will experience simply because of your adult age. By default, if you are above 35, you are classified as advanced in maternal age. The frequency of your antenatal care is not going to be the same with women below 35. We will treat you specially. Now, your babies can be delivered through the vagina if it's indicated, or through CS. Now, CS stands for cesarean section. It's a salvage method of delivery. Prior to the advent of CS, so many women died during childbirth. So many babies died during childbirth. So think about when our grandmothers, when our grandfathers had our fathers. We didn't have anything like CS then. Majority of women that had complications, which could have been saved if they had gone for CS, died. Now, in 2022, no woman should die from childbirth. No mother should die from simply bringing forth something that will give her joy. So if you go for your ANC, we are going to monitor the baby. We are going to monitor you. And we are going to choose the best method for your delivery. There are some women by standard, from day one, we will know they will have CS. That type of CS is called elective CS. So depending on the progress of your pregnancy, there are certain conditions that will place you on planned CS. It's called elective CS. We are going to monitor you. We are going to monitor your baby. When we are sure that the baby is good, then we are going to deliver you on a set date. So women that have some medical conditions, like chronic medical conditions, which are poorly controlled. So if you have poorly controlled diabetes, or you have hypertension emergency, which is called preeclampsia, we can deliver you ahead of time through CS. Now, if you previously had very difficult delivery, very difficult pregnancy outcome, some women can have recurrent loss of their babies. Some women can have recurrent stillbirth. Remember the difference between stillbirth and abortion. When you lose your pregnancy before 20 weeks, unintended, it's called abortion or miscarriage. When this happens beyond 20 weeks, it's called stillbirth. Now, if you have an indication and we were worried that your baby is going to be compromised, that your health is going to be compromised, we are going to deliver you on a site through the process of CS by election, elective CS, planned CS. We are going to give you a date. We are going to bring you in. Then we open you up. We bring out your baby. Then you will have your baby saved. Now, unfortunately, some women, in course of going for vaginal delivery, they might have complications. So you can have obstructed labor or prolonged labor, or the baby can be compromised. The baby is not getting enough oxygen. We can go for what we call emergency CS. Between the two types of CS, emergency CS is not good because anything can happen. The life of the baby might be in danger. The life of the woman might be in danger. But if we have an elective CS, we are going to give you a date. We are going to make sure you're good. Then we deliver your baby. Now, here is the deal. If you don't have any reason to go for CS, vaginal delivery is the best. In America here, majority of women will deliver vaginally. Out of every 3 pregnancies, 2 will be vaginal delivery. So if you don't have any indication to be delivered through CS, please, vaginal delivery is the option. Now in CS, because it's a major surgery, there are likely complications, which can include bleeding, which can include infection, which can include sustained pain, which can actually also include complication in your baby. So anytime you're going for surgery, there are likelihood you will have excessive bleeding, you will be exposed to infection, or you will have different complications, and some women can go for anesthesia. So going for CS, in as much as if it's done properly, you will have fewer complications, but it's a major surgery, so you can have complications. Between CS and vaginal delivery, the possibility that a woman might likely have complications between the two of them, it's on CS. So a woman going for CS can likely die compared to a woman that is going for vaginal delivery. So if you have to go for CS, it must be well planned ahead on time. We must have an indication. Some babies might be very big. If the woman's pelvis, it's little to contain the baby, then we are going to go for CS. So some babies are born very big. Some babies might have placenta problems. Some babies might have other complications. Anytime we discover that your baby is going to be compromised, we are going to section you. CS is an option when delivery by the vagina can put the life of the baby and your life in danger. Now, vaginal delivery has its own cons. In some women, they can have prolonged labor. In some women, during delivery, they can have tear. So some women can have the vaginal tear when the baby is coming out. Fortunately, we can suture the tear through the process of episiotomy. If it's not properly controlled, some women can actually have tear that can extend from the vagina to the anus. This is what we can avoid if we go for your ANC. In some babies, if the baby is not presenting with the head, and we have done everything possible to flip, to make sure that the baby is coming with head, that's also an indication for CS. If you are having more than one baby, that means you're having twins or triplets or quadruplets, the likelihood you're going to have your baby through CS is very high. So all the women that are going for multiple pregnancy will likely have CS. Why? Because you don't want to take chances. Now, here is the deal. When you have CS, the possibility that all subsequent future deliveries are going to be CS, it's high. This is why we need to be careful. If you don't have any indication for CS, the best method of delivery is to go through labor and have your baby. Now, some women can be qualified to have what we call VBAC, that's vaginal birth after CS. But here is the deal. Because of the fear of uterine rupture, of womb rupture, of complications, most providers will prefer to continue having CS. But if you're in a facility where they can handle complications, some women that had CS can go further and have vaginal delivery. And some women that had vaginal delivery can subsequently have CS. But guess what? It doesn't matter how your baby is coming. It's how your baby will be when your baby is born. So if you are having your baby through the vagina, that's okay, 100%. If you are having your baby through CS, that's okay, 100%. Now, here are a couple of advantages. If you're having your baby through the vagina, you are going to go home early. Within 24 to 48 hours, if you don't have any complications, we send you home. Compared to CS, you are going to stay in the hospital a little bit longer. Now, women that have their baby through the vagina can easily start bonding with their baby, start breastfeeding. If you have CS, the likelihood we are going to stabilize you, you'll recover, and when you begin to give your baby breast milk might be delayed. So these are a few advantages. So you can room in with your baby, you can start, playing with your baby, you can start breastfeeding with your baby if you have CS. Sorry, if you have vaginal delivery. But when you have CS, you're going to recover from that pain. You're going to have a couple of things that we need to monitor before we begin to think about you feeding your baby. Now, across the board, pain is what motherhood is all about. Becoming pregnant is painful. Carrying your pregnancy is painful. Going into labor is painful. Now, please, in 2021, you have a choice to determine how you're going to manage pain. So some women can go for anesthesia. Some women can go for what we call epidural to manage your pain. You are going to experience pain. But guess what? When a mother is expecting her baby, no pain can stop her from the joy of seeing her baby boy, of seeing her baby girl. The pain a mother goes through is the pain of love, is the labor of love. So all women will go through pain. For some reason, I don't know why God made everything about women painful. You're bleeding, pain. You want to become pregnant, pain. You're having labor, pain. You give birth to the baby, pain. You go through CS, pain. So everything about women is pain. This is why we need to respect women. This is why we need to honor them. We need to love them. We need to take care of them because they go through a lot. Now, if you are in a group and you are above 35, the likelihood you are going to have CS is high. So most women that are older will likely go for CS compared to younger women. Okay, now when you are going for a couple of things, when you are going for CS, there are certain things you can avoid compared to when you're having your delivery through the vagina. Women that go for episiotomy or women that have tear can suddenly discover that they have weakness in the pelvic floor muscles. So when you are smiling, when you are laughing, when you are crying, urine will begin to leak from your vagina. You will begin to leak fat from your anus. So when we tamper with the pelvic floor muscles through episiotomy, when you go for vaginal delivery, you can have weak pelvic floor muscle. But guess what? You have to start practicing Kegel exercise. Admin, please copy and share the Kegel exercise and link. Every woman should be conversant with Kegel exercise. When you engage in Kegel exercise, you're going to strengthen your pelvic floor muscle so that when you're smiling, when you're laughing, when you're crying, urine will not be leaking from your vagina. These are a few facts you should be conversant with. But here is the deal. Regardless of how you're having your baby, please do not waste time. Don't compromise standards. Don't think you're going to deliver like the Hebrew women and your baby will die or you lose your life. The concept of Hebrew women is complete nonsense in medical practice. If you are going to have your baby through the vagina, proceed. If you have an indication for cesarean section, do not query your doctor for 1 second. 1 second delay can delay the outcome of that pregnancy. You can injure your baby, you can harm your baby, you can die, you can bleed to death. So delay is completely unacceptable. Unfortunately, in our group, most times we hear women that come in and say, oh, my husband wants me to deliver to the vagina. My husband wants this. My husband wants that. I understand that. But guess what? You are the woman. You are the person that will bring forth this baby. You need to know what's okay for you. You need to be your best advocate. You need to emancipate yourself. You need to empower yourself. You are the person carrying this baby. So the method of delivering your baby doesn't matter. What matters is that you're going to be a mother. So don't cause delay. Unfortunately, before we started this group, so many women died during childbirth because they insisted on having vaginal delivery. Meanwhile, your baby is not meant to come to the vagina and you die on the table. So many women bled to death. No woman should die bringing forth her baby. Admin, capture this for me. None of our members should die, whether it's vaginally, whether it's CS, bringing forth your baby. The same way your mothers gave birth to you is the same way you will give birth to your baby. So please be careful. Now, what are the things you can do to make sure you have good outcome? You have to enroll in ANC on time. We have to know the position of your baby. The likelihood that your baby is going to be the same when the presentation is at 36 weeks is very high. So if you're 36-week pregnant and your baby is coming with the head down, then the likelihood your baby is going to present that way is high. If you're 36 weeks and your baby is presenting as breech, the likelihood that your baby is not going to turn again is high. But before 36 weeks, your baby can flip, your baby can start with head and end with breech, your baby can start with breech and end with head. Now, there are a couple of things we can do to see if we can turn your baby to present with head. But if we fail, you're going to be sectioned. Thankfully, gone are the days that when we want to go for cesarean section, we open you wide up. Lately, when you see a woman that go for CS, you won't even know she has CS. Very tiny, bikini, cesarean section. We bring out your baby, you're pretty good, you recover, and you're good to go. Now, this is the reason why you need to wait for 18 months before you become pregnant again. So it's not ideal to have a baby within 3 months. You become pregnant again. Why? Because you are not fully recovered. Because your vagina has taken a lot of it. Because your womb has taken a lot of it. So you need to allow at least 18 months to pass before you begin to think about becoming pregnant. So what do? You make sure you use reliable contraceptive. Very important. So in a nutshell, if you are currently pregnant or if you are believing God to be a mother, the most important thing is to become pregnant. The second most important thing is to carry your pregnancy to term. The most important thing, like the top on your list, is to behold your baby, and your baby is completely okay, and your baby is not damaged, and your baby is not compromised. This is the joy of motherhood. Whether you have your baby through the vagina, whether you have your baby through CS, you are the same. Stop the shame against CS. Stop the stigmatization. There is nothing wrong with you, my sister. You're a mother. You're a mother. Okay? Thank you so much. Right now, I'm going to open the clinic so I can take care of your questions. Okay, so please go ahead and ask your questions now. Okay, so let's see what we have. Okay, so the clinic is open. You can go ahead and start asking your questions, and I'll provide you feedbacks. Thank you, Dr. Ndiche, for providing feedbacks. But right now, I'm going to look for questions, and I'm going to provide you feedbacks. So give me 1 minute. You can go ahead and start asking your questions. Please start asking your questions if you're in YouTube. if you're in my private timeline, if you're in our page, if you're in our group, you can now start asking your questions. I'm ready to provide you feedbacks. Okay. Hold on. Guys, give me just 1 minute. I'm going to get a question, then I'm going to use it to teach. Okay, let's see. Where are the questions? Yeah, God bless you guys too. Okay, now someone is asking about the weight of the baby. Now, in order not to confuse you, babies are classified weight-wise based on the expected date of delivery, based on what we call gestational age, based on constitutional factors. If you attend your ANC, if you eat healthy, if you're not stressed, your baby is going to be within the normal range for weight. Now, when you are not attending your ANC and when you're not eating properly, your baby can be born low birth weight. Now, some babies can also be high birth weight, especially if the mother is a diabetic mother and the baby becomes what we call macrosomic baby. So the secret is to make sure you attend all your ANC. I'm not going to go into the details about the numbers because it can be confusing. If you are attending your ANC, they will tell you if your baby is developing okay. There are a couple of ways you can do that. When you go for your ANC, when you go for your scan, we can check the weight of the baby. We can make sure that it's corresponding to the expected gestational age. So assuming you're 38 weeks, and we look at your baby and your baby is looking like a baby at 28 weeks, that's a problem. We need to start getting worried. Assuming you're 28 weeks, then we look at your baby and your baby is looking like a baby at 38 weeks, then we begin to worry. One of the things that can lead to that is diabetes. So we need to be careful. This is the reason why you need to attend all your ANC. Don't miss any of your ANC appointments, okay? Remember that if you're pregnant in this group, we encourage you to join our ANC group in Telegram. All pregnant women, regardless of your trimester, first trimester, second trimester, third trimester, you don't want to go alone. You want to go with us. We can go with you. We can ensure that your baby is okay. We do not want to hear any stories that touch the heart. This afternoon, I was so blessed to hear from one of our clients in Sierra Leone. Within the period she was under me, she had her 2 babies, a baby girl and a baby boy, within a period of 3 years. This is a lady that had no hopes from Sierra Leone. So regardless of where you live, if you can perform, if you can practice, if you can pray, if you can play, if you can be judicious, if you can be meticulous, if you can be intentional, you're going to be a mother in 2022. Nothing can stop that. Okay, so guys, let's continue. Keep asking your questions, please. Okay, keep asking your questions. Hopefully, I'm going to get to your questions and I'm going to provide you feedback. Okay, let's see what we have for there. Okay, Doc, is it true that your position after sex determines the sex of the baby? 100% incorrect. Complete falsehood. The position of your sex, whether you're hanging your head up, whether your back is faced to the wall, whether you're lying flat on your belly, it doesn't matter. The position of your baby is determined by your baby. Your baby can swing, your baby can go up and down at 36 weeks. If your baby is coming with head, your baby is going to be delivered through the head. If your baby is coming through breech, we can try and see if we can swing the baby through the process of external cephalic version. But it doesn't matter the position of your baby is going to come, and it's not dependent on your position of sex. Okay? Completely nonsense. Be careful what you listen to. There are so many nonsense. You guys listen to that, and you begin to be afraid. Remember, when you are afraid, fear sucks. Fear can elicit a lot of things that is not going to happen, and you begin to live in tension, and you begin to live in stress, and it's going to mess with you, and it's going to mess with your baby. Don't be afraid of anything. God has promised you you're going to be a mother, and a mother you will become. Unfortunately, it's going to come through pain, but there is completely no need to be afraid. Okay, let's continue, guys. Keep asking your questions, please. Okay? So let me continue. Let me look for questions. So today, remember, we're talking about CS and vaginal delivery, okay? Okay, here we go. Okay, how long does it take to get pregnant after removing IUD? So there is no fixed time. What's going to determine how you're going to get pregnant is your fertility. So your age, the availability of the eggs, the availability of good sperm. But here is the deal. Anytime you have used a contraceptive and you stop using it, there will be a period of infertility. That period of infertility is the period when a particular contraceptive is still in your body, especially if you're using hormonal contraceptives. If you're using barrier, no problem. So if you're using IUD, intrauterine device, by the time you stop using it, you are not going to get pregnant immediately. Why? Because there is still a period you still have those contraceptives in your system. If you're using patch, if you're using injectables, if you're using oral contraceptives, when you stop, you will have a few period of infertility, which is a period those hormones you took is still active in your body. Once those hormones in your body are neutralized, once they are washed off, your fertility will bounce back. The biggest factor in your fertility is your age. So long as you have eggs, you can have a baby. Unfortunately, as you're getting old, your eggs are getting old. So the biggest factor in becoming a mother is your age. The earlier you have your babies, the better. You can still have your babies in your 50s. You can still have your babies in your 60s. You can even become a mother in your 70s. But how you become a mother in your 70, 60, 50, 40, 30, 20 is entirely different. The best time to have all your babies is in your 20s. Unfortunately, so many women are not going to even find their best partner at age 20. Why? Because we are facing reality. Some of you might be in toxic relationship. Some of you might not have a career. Some of you might not have money. Raising family requires money. Treating infertility requires money. Going for pregnancy requires money. Starting a family requires money. So the possibility to have good education and you find money when you're in your 20s is limited. Unfortunately, we have so many women that got married early. They were turned into slaves. They were turned into baby-making factory. Why? Because they don't have the power to make their own money. Because their husbands were abusing them. They only use them to bring forth babies. But please, empower yourself. Make sure you take good care of yourself. Know what you need to know. Acquire your knowledge. Change your attitude. Find someone that will help you. Be in a group that will teach you every day. Know your body. Every pregnancy must be fully planned. Advocate for your baby. Let me give you an example. Your pastor tells you, you know what? You're going to have a vaginal delivery. No doctor should tell you otherwise. You're going to have your baby like Hebrew women. Then you gulp it down, hook, line, and sinker. Meanwhile, your pastor came to America and had CS. But they are deceiving you because of religiosity. Now they will poison your husband's mind. Your husband will come when you're in labor, when you're not even supposed to be in labor. You're supposed to go for CS. And your husband will keep telling you, I don't want my baby to come through CS. I'm going to deliver like Hebrew women. They begin to pray. They begin to sing a lot of incantations. Meanwhile, God told you you're going to have your baby through CS. And you will die on the table. And the pastor or whoever it is will say, oh, it's the will of God. Let's praise God. God doesn't want you to die. So be wise. When you are knowledgeable, when we tell you to go for CS, you're going to be a little bit afraid. Nobody wants to be opened up. But you're going to know you're advocating for your baby. By any means necessary, by any means legal, protect your baby. The best way you can protect your baby is to acquire the real knowledge. Is to advocate your baby. Is advocate for your baby. Is to go for all your ANC. Is to live healthy. A healthy woman will have a healthy baby. Whatever you eat is affecting your baby. However lifestyle you're acting is affecting your baby. If you're smoking, it's going to affect your baby. If you're drinking alcohol, it's going to affect your baby. If you're not watching your body weight, it's going to affect your baby. If you only eat cake and ice cream and all those nonsensical food, it's going to affect your baby. So you are your baby's ambassador. How you live will reflect in your baby. If you want to have a healthy baby, if you want to have a handsome son, if you want to have beautiful daughters, start living healthy. This is your biggest investment. Invest in your pregnancy. Invest in your infertility. Don't be comfortable. Unfortunately, some women become pregnant, then they run away. Some women spend 20 years going from pillar to post. Eventually, they become pregnant. Then they begin to become smart. They run away. They only come back when they have complications. The biggest best investment in your pregnancy is a doctor that knows, will follow you up, and you have your baby. If the only thing you have succeeded in achieving in 2021 is to have your baby, you are the wealthiest. So if you are currently pregnant, admin, please make it a point of duty to help all pregnant women in this group to transition to our ANC. It's a choice that is highly recommended. Every pregnant woman, when you confirm your pregnancy, there are 3 things you must do: urine test, blood test, and ultrasound. Once we have confirmed through ultrasound that that baby is developing inside your womb, you have to register for ANC immediately. There are certain things that are expected of you. There are certain things expected of us. There are some ultrasounds we have to do. Like by the time you get to 20 weeks, we are going to do what we call our anomaly scan. We are going to check all the important organs in your baby, and at that visit, we can tell you if you're having a boy or a baby girl. These are standards that must be fully practiced by all women. So let me wrap up. The most important thing is becoming a mother. The most important thing is hearing the cry of your baby. The most important thing is hearing the cry of your husband. The jubilation, the cutting of the umbilical cord, the party. This is the most important thing. There are 2 ways you can have your baby: vaginally and CS. Whichever option they give you, don't query it. Don't die trying to be smart. Don't damage your body. Don't damage your baby. Protect your baby. If you're going to have vaginal delivery, proceed. If you're going to have CS, proceed. It's okay. If you're going to have multiple pregnancy, prepare for CS. If you're going to have triplets, prepare for CS, because likely you have CS through that means. Okay, so thank you for coming. Make sure you join me tomorrow for my word round. Then on Sunday, we're going to also find a good topic we're going to talk about. Now, if you also are in Face Youth, tomorrow we have a very important program: drug abuse and substance abuse in our youths. Make sure you join me tomorrow. I'm going to anchor the event. Make sure you come in so you can learn. Until I see you tomorrow, God bless you, and remain steadfast. Continue praying, continue playing, continue practicing. If you need help, please come. We can help you. You can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. If you are already pregnant, you can come in. Everybody is going to succeed. You're going to be a mother. You're going to be a father, and nothing can stop you. God bless you. I love you guys, and bye-bye for now.